What is disseminated TB in immunocompromised people? Imagine a tiny bacteria called Mycobacterium tuberculosis that usually targets the lungs. In healthy people, the immune system can often contain it. But in those with weakened defenses, things can get much more serious. When tuberculosis spreads beyond the lungs to multiple parts of the body, it is called disseminated tuberculosis. This means the bacteria travel through the blood or lymphatic system and infect organs like the liver, spleen, bones, kidneys, adrenal glands, eyes, and even the brain. Instead of just lung symptoms, the infection becomes a widespread illness affecting many systems. People with compromised immune systems are at much higher risk of developing this form of tuberculosis. Conditions like HIV/AIDS, cancer treatments, or organ transplants weaken the immune response, especially the cell-mediated immunity that fights off tuberculosis bacteria. When the immune system cannot contain the bacteria, it can rapidly spread throughout the body. Sometimes this happens soon after initial infection, within weeks, but it can also occur years later if a latent infection reactivates. The symptoms of disseminated tuberculosis are often nonspecific, making diagnosis tricky. Common signs include fever, night sweats, weight loss, fatigue, and general malaise. Because many organs can be involved, symptoms vary widely. For example, bone pain might occur if bones are affected, abdominal pain or diarrhea if the gastrointestinal tract is involved, and neurological symptoms if the brain or spinal cord are affected. Blood in the urine can happen if the kidneys are involved, and adrenal gland infection may lead to hormonal imbalances. Diagnosing disseminated tuberculosis in immunocompromised patients can be challenging because symptoms often overlap with other infections or illnesses common in these populations. Imaging tests like chest X-rays or CORT scans may reveal characteristic patterns such as millet, seed-like nodules in the lungs. Confirming the diagnosis usually involves microbiological tests, including analyzing tissue samples or fluids for Mycobacterium tuberculosis DNA using nucleic acid amplification tests. Sometimes, a biopsy or culture is needed to identify the bacteria definitively. Treating disseminated tuberculosis requires a long course of combination antibiotics, typically lasting between 6 and 12 months. The treatment plan is tailored to the patient's immune status and which organs are involved. Early detection and prompt treatment are vital because this form of tuberculosis can lead to serious complications and has a higher risk of death compared to cases confined to the lungs. Managing the illness involves close medical supervision, and patients should always follow their healthcare provider's advice. In summary, disseminated tuberculosis in immunocompromised people is a serious, widespread infection caused by the spread of Mycobacterium tuberculosis beyond the lungs. It often presents with vague symptoms and can affect many organs, making early diagnosis and treatment essential. If you or someone you know has a weakened immune system and shows signs of systemic illness, consulting a healthcare professional is crucial. Proper medical care can help control the infection and improve outcomes, emphasizing the importance of timely intervention and ongoing medical support.